Good afternoon, everyone. Thank you for coming today, and there might be some more turnouts from the members of the media, but nevertheless, I would like to start our periodic press conference, come briefing regarding Japanese government's responses to COVID-19. We will be using the same format as we did the last time. There will be a dozen or so registered viewers of this live stream, and they will be able to submit their questions via internet, through email. And we will be more than happy to answer all your questions as well. Today we have three of my colleagues from other ministries and agencies of the government who will be happy to brief you on the current status surrounding the measures. On my right hand, I have Mr. KOJIMA, Masaru KOJIMA, who is the Councilor in charge of Coronavirus Disease 2019 Preparedness and Response at the Cabinet Secretariat. On his right side, we have Mr. KURODA, Takashi KURODA, from the Cabinet Office, who is the Deputy Director General for Economic and Fiscal Management. And then farthest to my right hand side would be Mr. Kazuho Taguchi from the Ministry of Health, Labor and Welfare. Mr. Taguchi is the Director at the Office of Global Health Cooperation, International Affairs Division. There are some other members, colleagues from the government who are seated in the same room, who might also be able to make some comments or remarks depending on the substance of the questions as well. So without further ado, I would first like to invite Mr. KOJIMA to make his opening remarks.
Thank you for the introduction. I am KOJIMA from Cabinet Secretariat. First of all, I would like to start about the countermeasures regarding the coronavirus here in Japan. The last time, it was the 8th of April that I was here. Since then, on the 16th, as of April 16, the number of infection went above 9,000. Above 9,000. On that occasion, it has increased further, and as of the 22nd, it is more than 12,700. Mainly from the urban centers, the infection is spreading to non-urban regions. However, the so-called explosive expansion is not what is being observed. As for the Japanese government, on the 16th of April, which is last week, April 16, the state of emergency prefectures were extended to all other places across the country of Japan. Before that, 7 prefectures were covered by the emergency declaration, but that was extended to the whole of Japan. In particular, Hokkaido, Ibaraki, Ishikawa, Gifu, Aichi, and Kyoto, these 6 prefectures, just like the initial 7 designated prefectures, there was a significant rise, and therefore these 13 prefectures are now called prefectures under specific cautions, and it has been extended to all the prefectures because infections are increasing in all the places, so the declaration was extended to the whole of Japan. On the occasion of extending it to the entire nation, expert opinions have been gathered. The reason why it was extended to the whole of Japan, there were 5 reasons. Number one, across Japan, cumulative infection went above 9,000, and in addition to the 7 areas where the emergency were declared, because of movement of people from urban areas, clusters had spread and occurred in other places. The second reason is in such areas, medical services are sometimes not sufficient. The third reason was this declaration of emergency. If this extended nationwide, the Japanese people's behavioral transformation was to be further encouraged. We wanted the people to change their behavior, their actions, and their movement. In the middle of March, there was a 3-day consecutive public holiday. There was some relaxation sort of atmosphere, and it is believed that infection expanded during the 3-day holidays. So that was also given consideration. And the fifth reason, if there are lax restrictions in some of the places, people would move to places with lax or relaxed restrictions, and therefore it was considered necessary that the entire country must have the same level of restrictions. In particular, in Hokkaido or in Okinawa, where there are popular tourist sites, there is a trend of expansion of infection. This is not only a matter of large urban centers. Because of these situations, the emergency declaration was extended to whole of Japan. Going forward, there will be the so-called Golden Week, national holidays, longer-term holidays or homecoming. Because of such events, it is a season where there will be large movement of people. During those national holidays, the movement of people must be maintained as little as possible in order to contain the spread. And therefore, the state of emergency in all the prefectures, because there was a fear that there could be an increase of infections, and because the Golden Week is coming, we have extended the declaration to the whole of Japan. Person-to-person contact has to be reduced in order to prevent infection. In the basic plan, there must be thorough effort to reduce person-to-person contact, which would enable containment of infections, and if possible, 80% reduction of contact is the goal. At the government, using the geographic information of mobile phones, demographic changes in different areas have been analyzed, and we are collecting the data before the declaration. And this is the panel information. So this data is updated on a daily basis, and people's movement are monitored. Please look at the slide, this panel. Tokyo, and in particular Shinjuku, Yokohama, Nagoya, Osaka, which specifically is Umeda. These are the data for the 4 locations. In the upper part of the 2 numbers, according to mobile telephones, the geographic information, big data, is the basis, and people's flow, people's movement is analyzed. 69.3% for Tokyo Shinjuku on the left-hand side above. This is before the expansion of the infection. That was mid-January through mid-February. Compared to back then, the people's movement, how much reduction has been observed is what is indicated. According to Tokyo, it's down by 69.3%, Yokohama down by 66.1%, Nagoya down by 64.1%, Osaka down by 74.5%. So this is reduction of people's movement. which means this is to reduce opportunity, not exactly to show the reduction in opportunity of direct contact, but it could be a kind of a certain indicator that there could be less person-to-person contact. The lower part number, the lower number of the two numbers, according to Japan Railway, these are the number of people who have gone in and out of the ticket gates of train stations according to JR, and this is compared to the same date of the year before. For example, in Tokyo Shinjuku, down by 76.0% compared to the same timing of the year before. In 2019, the number of people who passed through the ticket gates went down by 76%. In the case of Osaka, down by 74%, the people who passed through the gates. So as request is made for people not to go out of their home, there is a significant level of cooperation, and to a certain degree, people's movement has been suppressed, and therefore these efforts must continue so that further efforts will have to continue so that people voluntarily refrain from leaving their home. Thank you. At the moment, the government has the basic policy, and different prefectures, the local government authorities, under the judgment of the governor, necessary countermeasures are being implemented. And therefore, the government will continue this effort so that people avoid leaving their homes to reduce the opportunity of contact as much as possible. And we continue to ask for the cooperation of the Japanese people. Thank you.
Next, I would like to invite Mr. KURODA to make his opening remarks.
Thank you very much, KURODA from the Cabinet Office. And previously, at the previous meeting, I talked about what was decided on the 7th of April, the emergency economic measures. I have introduced that last time. And this time, the emergency measures were revised. So I'd like to talk about the revision that has taken place. As for the change, it's just one part which has been changed. Support for the household sectors that are in severe difficulty to provide legal assistance. 300,000 of handouts was the scheme previously. We had that scheme in place. But after the decision has been taken, we found that there have been households which saw a decrease in income, but they were not targets of this handout, and there was some sense of unfairness. And as the Cabinet Secretariat explained earlier, the infection is spreading throughout the nation, and the status of emergency declaration was now to cover the entire nation. And there are people who will be subject to constraints in movement. And the citizens throughout the nation will now be under constraint. And there are households which will not see an decrease in income. The healthcare personnel and nursing personnel who are fighting in these difficult circumstances. The previous scheme did not provide them with handouts, and public officials who are working for counter infectious disease measures and others who are fighting under the difficult circumstances. The nation as a whole needs to unite under the present circumstances. That was the judgment. So as to the target of the handouts, we felt that it was not preferable should there be a division among the public, among the ruling party and the opposition. There were such views. So the Prime Minister has taken the decision so that it will be across the board 100,000 yen handout for all of the citizens. And that is the change. And that is the point of change. So based on this, 108 trillion yen was the size of the economic package previously, which I announced, but this is now changed to 117 trillion yen. When I explained earlier, the economic effect could not be explained because the estimates were not prepared. The previous 108 trillion yen package, if that had been effectuated, it would push up GDP by 3.8%. And I talked about the effect of this. And with the addition of 9 trillion yen, there'll be an effect which exceeds what I mentioned previously. So next week, a supplementary budget to back this up will be formulated. And once this is approved, local governments and other entities concerned, we will cooperate with these so that we could implement the measures as soon as possible. That is all from me. Thank you.
I would like to invite Mr. Taguchi from the Ministry of Health, Labor and Welfare to make his opening remarks.
Thank you. From MHLW, I am Director, Office of Global Health Corporation. My name is Taguchi. I will talk about the infection situation in Japan related to COVID-19. Please find this document. First of all, about the situation of the infection, page 2. As of the 22nd of April, 6 p.m., those tested positive, 11,919 on the left-hand side above, which is up by 422 from the day before. So far, 2,408 have already been discharged from the hospital, which is plus 70 from the day before, those who were discharged. Unfortunately, the fatalities was cumulative 287, which was an increase of 10 from the day before. The next is page 3. And this is based on the date of the report. And this is the trend of the number of confirmed cases according to the date that was reported. From the 10th of April, that was like reaching 700 per day. And more recently, in the last few days or so, it is about 400 per day or so. Page 4. This shows the positive cases by age bracket. According to this date, in the teens or under 10, very few cases of children, but in the case of Japan, in the 20s, in the 30s, the 40s, people not old, still there are some 2,000 who have tested positive, which means not all the population, the infection rising. In the 50s, above 2,000. The people in the 60s, about 1,300. In their 70s, about 1,000. And above 80 years old, there's above 900 who have tested positive. So in this way, even the young people do test positive, but those who develop severe cases or lose their lives, indeed, these are mainly in the elderly population, which can be observed by the graph on page 5. Up until the 30s, very few fatalities, but in their 40s, people in their 50s, 60s, 70s, above 80 years old, as the population becomes older, there are more severe cases, or very unfortunately, lives are lost. Death rate, fatality, is also indicated. Again, overall, it's 1.8 death rate for the entire people, but according to age rising, you can see that the fatality rises as the people are older. And another graph which shows the trend is page 6. This is for different prefectures, cases depending on the prefectures. Indeed, Tokyo, 3,500, close to 3,500, very large in Tokyo. And then comes Osaka, 1,500, close to 1,500, or Fukuoka. These are the places where there are a large number of cases, and Saitama, Aichi also above 500. The next is the trend of death cases in several countries. The graph is on page 7. According to this graph and the death rate of Japan, on the right-hand side, you can see the blue line for Japan. It looks as if the death rate is rising all of a sudden. So please allow me to explain. So far, in the case of Japan, the data matching and verification, when there are positive cases, the prefecture government will report about the positive cases, and that would be reported to MHLW. And for the death case, the local government authority will make that information public, and at the same time, they will match the data and make sure to confirm which individual had passed away. At the ministry, we show both numbers in our press releases. And according to this WHO situation report, the data matching and verification, those who have been confirmed after the data matching verification were reflected. But for example, the local government authorities are getting busy and there are more cases, so it has been difficult to catch up with the data matching verification. And sometimes we are lagging behind, and therefore what the local government authority has announced in terms of the death, we changed the method of reporting the death. So at the very end, it looks as if from the 20th to the 21st, it looks as if Japan's death has suddenly jumped up. But that is partly due to statistical changes. A few days after that, even if the graph might flatten a little bit, it is partly due to statistical changes, so it may not exactly reflect the real trend of the death cases. This was discussed in the last briefing as well. To detect the clusters as early as possible, to enrich medical services, and to encourage behavioral changes of the people is what we will continue to do. Page 9, to avoid the 3 C's. And page 10 is about the PCR testing system, which I will not talk about. Page 11, this is the PCR testing capacity and the actual testing undertaken. In terms of the capacity in the recent cases, 15,000 per day, or above 15,000 per day. That is the recent capacity of Japan. The actual number of testings, as of last week, it was like above 8,000 or so. The graph seems to go down in the more recent days, but there is a lag time in terms of statistical analysis. So in some of the cases, because it could be a weekend, there could be a drop in the number of testing rather than constant increase. But we are trying to keep the peak of infections lower and to delay the peak. And one more point. Yesterday, there was the experts' council of the new virus. They analyzed the situation and recommendation has been issued. The Japanese version is available on the web page. The number of infections has to be kept down, and changing the behavior is important. So if there is a number of 500 infected persons in a prefecture, about to reduce contact by 18%, then within 15 days or so, there could be a reduction of new cases. But if it is only 65% reduction, then 90 will be required. Longer time will be required to keep the infection down. So 80% reduction of person-to-person contact is what is recommended. And in order to reduce a person-to-person contact, there are 10 recommendations. For example, there is the Golden Week holidays that will be arriving. Please do not go back to your home. Please communicate with your families and relatives through online technology, for example. In addition to that, the medical services and welfare services, that there should be no discrimination for people working in the healthcare services or the medical services. The roles have to be divided, and accommodation, hotels have to be maintained, or the PCR testing capacity, and not only increasing capacities, but technical human resources also have to be expanded. Or, according to the governors, the importance of the leadership of the governors of the prefectures were emphasized according to the COVID-19 Expert Advisory Council. That is the summary of the recommendation. Thank you.
Thank you, Chi. So in a moment, I'll be opening the floor to questions. If you would, for those of you who are asking questions, I would like to ask you to state your names and affiliation. Also, the viewers online will be able to submit their questions by email as well. I've already received a couple. And do submit your questions if you have something to ask. Just to remind you, the handouts should have been sent to you by email. In case it has not reached you, do let us know and we will resend it to you as well. So now I would like to open the floor for questions. Please.
Radio France の国営ラジオ、ラジオフランスの西村ですけれども、いくつか。
Radio France, Nishimura is my name. I have several questions. 2 days ago, approximately 2 days ago, several media sources suddenly said that those who have died suddenly proved positive as a result of the PCR tests. Were you able to confirm this information? Do you have more details on this? Please enlighten me.
1点目ですけど。
And that's the first question. Should I state all my questions?
その後は。
And those who are suspected of dying from influenza, according to data from Tokyo, there's not a reduction in the number. It's higher than the average previous years. Pneumonia and influenza included. This is a number that includes pneumonia and influenza. And the data from Kyushu has also come out. The death numbers are still very high. Can you offer an explanation for this phenomenon? And the third point, when do you think you will reach the peak? And when the peak is reached, all of a sudden, if there's an increase in infections, will you take more stringent measures? Are you able to take more stringent measures under the present law? You cannot force people to stay at home. Are you thinking of revising the law? Please.
Okay. I think most of the questions should be directed to Mr. Taguchi. Taguchi-san, I think regarding the first question, do you know what she means by the case a couple of days ago? Okay, so I think Mr. Kato will be answering the first question.
一つ
The first question and the second question, Kato will respond. The first question, according to media reports in Japan, according to the police, those found dead on the street or in rooms, according to the PCR, it was tested positive post-mortem after a death. And from the National Police Agency, NPA, we did talk with the police agency about this situation. According to the police, for those who passed away for unknown causes, found on the street or found alone in rooms and dead, there will be the post-mortem by coroners. In that situation, medical experts, if they are suspicious of the virus, they did do the PCR test over the body, and the positive cases were confirmed out of the death cases. And the second question, at the NIID, National Institute of Infectious Diseases, for influenza and pneumonia-caused death, there is the data. At the public health centers, the death statistics, there is the notification of death. These are analyzed, data is input. If the cause is influenza or pneumonia, the pneumonia influenza caused death data is provided. As for these numbers, at the moment, it is not the case that all public health centers are inputting the numbers, so this is not the final confirmed numbers. This is only a tendency. It is true that there are large number of deaths according to influenza and pneumonia, but it is very approximate. And it is difficult to make a scientific assessment because it is only a very rough number. Across the country, it is only Tokyo where there is an increase, and even larger than at the same time last year. So just looking at this number of death according to influenza and pneumonia, interpretation is difficult.
And regarding the third question, when do we think the peak should be coming, and what other measures are conceivable to strengthen to actually strengthen the restrictions on people going out? I think we actually have a similar question online from Walter Sims of the Straits Times, in which he says, can you comment on what more must be done to keep people at home and ensure they avoid the 3 C's? And what kind of stronger action is enforceable beyond stronger appeals? So I think this question is rather similar. So perhaps I should ask Mr. Kojima and Mr. Taguchi to address this question.
Allow me to start about COVID-19. 14 days of incubation, latency, and after the onset of the symptoms, and becoming confirmed until they are counted, 2 weeks or so is the time lag. So the numbers that we are observing is what has happened 2 weeks before. The actual infection has happened 2 weeks prior to when we are talking. Therefore, according to page 3, around the 10th, it was about 700 per day. So the number has gone down since then, but we cannot be less alert. The whole of the Japanese population will have to continue their effort to reduce person-to-person contact and hence reduce the opportunity of infection. At yesterday's experts meeting, that there should be more teleworking, remote working, or at work offices. There must be good ventilation, improvement of ventilation, that there should be more sanitizations or disinfection activities, such has been recommended by the experts. And as for specific activities, it must be easy to understand to the ordinary Japanese public. So there were 10 points about shopping at the supermarkets. You should avoid crowded timings, that only one member of the family should go rather than the whole family visiting the supermarket. So such recommendations have been issued. I will add about the Special Measures Act. Stronger legislative measures was part of the question. So the Special Measures for Pandemic, Influenza and Infectious Disease Preparedness Act, the whole legislation, there is little restriction of private rights. It is rather less restrictive compared to Europe or the USA. There are no punishment. The lockdown is only a request, and it does not come with legal sanctions or penalties. And Article 5 of the Act on Special Measures, this talks about the protection of fundamental human rights, and there is a proviso as a result of the discussion at the Japanese Parliament. In order to implement this act, the private rights restriction should be minimal, that there must be maximum attention so that there will be the least possible restriction on personal rights, human rights, and private rights. Article 45, under Article 45, cooperation is asked so that people make effort to stay at home so that person-to-person contact can be reduced. And the demographic data was introduced earlier, so observing such data about people's movement, the spread of infection is analyzed, the effect is analyzed, and stronger requests could be made for facilities and commercial facilities to close or shut down. As for the facilities to request the restriction of the use, there is the basic countermeasures decided by the government headquarters. And according to paragraph 9 of Article 24, request is made not to go out of the home. And then, according to Article 45 of the Act on Special Measures, there will be more stronger requests, or there will be naming and shaming of commercial facilities that do not comply. About revising the laws, Minister Nishimura is also making his own comments on several occasions, but first of all, the Japanese population, the Japanese people must unite, must work in solidarity and make efforts according to the current Act on Special Measures. Then we should be able to go through and survive the situation, according to Minister Nishimura. But if infection continues and more delegation of authority to the governors, or should there be a more stronger, stringent measures that comes with punishment or penalties, if that is the wish of the Japanese population, then there could be further discussion. But first of all, maximum effort is made under the current Act on Special Measures.
Okay, thank you, Masan. We have 2 more questions from Walter Sims of the Straits Times. One of them is perhaps addressed to Taguchi-san. The question is as follows. Keio University Hospital said that 6% of its non-COVID-19 patients have tested positive despite not having any coronavirus symptoms. If we extrapolate this to the wider community, even if the KO sample size is quite small, does this not signal that there has been a widespread community transmission? And would not this pose a risk of even more hospital transmissions?
Thank you for the question. About the PCR testing capacity, currently it is like 15,000 testing capacity per day, which will be raised to 20,000 testing capability per day. If the medical doctor recognizes that the PCR test is necessary for a particular patient, we want to ensure that the test will be available. At the Expert Advisory Council, it has been pointed out that the public health centers, they do not have sufficient resources, or that the reagent may not be sufficient. But the testing capacity shall be expanded so that necessary tests can be executed. And I will hand over the microphone to Dr. Kato. Please allow me to add about the incident at Keio University. According to media report as of yesterday, they are not symptomatic. Those patients were initially not admitted because of the coronavirus, so the non-COVID-19, more than 60 also, they tested the antibodies and found out that a few percentage rate they tested positive, according to media report. I am aware of that media report. At the Keio University Hospital, about what Keio did, the number of sample is small, and therefore assessment is difficult based on this limited number of cases, and even if antibody was detected, whether they are currently infected or they were infected in the past when they were sick, that distinction cannot be made. And therefore, I find it difficult to comment about this case, but at MHLW, antibody testing, by testing the antibody, epidemiological study is ongoing by our ministry. From yesterday in Tokyo, the blood donation samples are used for this purpose. So by conducting these studies, the situation of the infection or the antibody test, the antibody detection rate, and other knowledges shall be gathered. And as the country of Japan, we would like to increase our knowledge.
Thank you, Kato-san. Perhaps we should remind Walter that the number of fatalities is also relevant, which in Japan's case, it's still relatively low. And I think your question implies that there could be some a wider spread transmission below the surface. But as far as we know, the fatality figures do seem to indicate that would not be the case. We have a third question from same Walter Sim, which goes, what criteria will the government look at in deciding whether or not to lift or partially lift the state of emergency on May 6th? I actually have a similar question coming from Motoko Rich of New York Times. Do you think it will be safe to lift the state of emergency on May 6th? So perhaps I should ask Mr. Kojima to answer this question first. And perhaps if Taguchi-san or Kato-san, if you have anything to add, by all means do so.
About lifting this declaration, at the moment, lifting the declaration, I don't think it is the stage to discuss that. First of all, the expansion of the infection must be curbed. 2 weeks ago, the declaration was issued, and the effect must be studied, and we must continue to follow the situation. Generally speaking, currently it is until the 6th of May, but beyond May 6, what will we do? On the 7th of April, it was declared, and to make a thorough request that people stay at home, it must be analyzed and verified. The infection situation, medical supply capability of different regions have to be given consideration. In the case of Hokkaido, the number of infection cases once dropped. But after that, there was a second wave of increase. Such incidents are observed, and therefore the basic countermeasures and the experts' advisory will all have to be reflected, and decision has to be made. Until May 6, of course, we want to end it. So at minimum 70% or possibly 80% reduction of person-to-person contact must be realized. So to the Japanese people, I know we are asking for a difficult life, but in order to reduce the infection, we strongly ask the Japanese people for their understanding and cooperation. So that would be the required procedure. But at this moment, all we have to do is to reduce infection, ask the Japanese population for their cooperation.
Takuma-san, Kazuho-san, do you have anything to add? Motoko Rich of New York Times also submitted 2 more questions. One is for Mr. Taguchi. Why is Japan still only testing at half its capacity? Once again, this is about the PCR testing. And a rather similar question to the one that we answered previously. Are there deaths from COVID that are not being recorded or detected?
About the PCR testing capacity, I mentioned currently it's like 15,000 capacity per day, which will be raised to 20,000 capacity per day. But the real cases is like 7,000 to 8,000 tests actually implemented per day. Our position is if the medical doctor considers it necessary for a particular patient, and we want to be flexible so that tests will be available for all the cases where the doctors consider it necessary. The public health centers, Hokenjo, even without going through the Hokenjo public health centers, if the medical doctor requires necessary, there should be a system available to ask private medical institutions to provide the PCR test. Such system changes have been implemented. So there is no intention of the government to suppress the number of actual cases, to the number of tests. The public health centers and the outpatient consultation center for Japanese returnees and possible contacts, they are burdened, and therefore the expert advisory council also discussed about the burden of PCR tests at these frontline facilities. This is burdensome, and therefore not only about the actual capacity, but how many tests would be conducted, the reagent quantity, or the human resources who can conduct the PCR testing. That also has to be given consideration, and assistance will be provided. In Shinjuku and in other places, there are facilities where They are called test centers, where the local medical association organizes facilities for testing. In local government authorities, the so-called drive-through type of testing facilities are starting by some local government authorities. Thank you. About unexplained pneumonia death, to conduct PCR over the dead body whose pneumonia is unknown. Yes, that effort is made. The government is trying to detect all possible, or as many as possible, COVID-19 death cases.
Okay, Taguchi-san, thank you so much. There's quite a number of questions on PCR testing, and I think you've answered a couple already. But I think since there's a lot of attention on this matter, perhaps if you can articulate a little more. The questions regarding PCR are coming from Isabel Renners of Bloomberg, as well as Simon Denier of Washington Post as well. They go, there are increasing number of reports that people who want to be tested are rejected. Why is that happening? And what is being done to remedy this question? So it's about cases of rejection that are being reported. Another related question would be Dr. Kenji Shibuya's statement. Dr. Kenji Shibuya said today that it would be possible for Japan to ramp up testing like South Korea. Now that Japan has more cases than South Korea, shouldn't it carry out more tests and isolate infected people? I think Taguchi-san referred to the new testing centers that will be set up under the initiative of the doctors' associations in prefectures. And he also mentioned some municipal governments taking the initiative to increase their testing and even introduce drive-through testing schemes as well. But if Taguchi-san, you can elaborate a little more on these as well, please do so. And Simon Denier's question, a similar question, is something that was answered previously about the flu-like symptoms. He refers to 20 to 50 extra deaths in Tokyo compared with what we saw, what we expect in late February. I think you've probably stated what you can on this question before, but if you have something to add, please do so.
I might be repetitive, but our position is if a medical doctor considers it necessary that a particular patient needs PCR testing, the test should be available. And in Japan, basically prefectures have the initiative in terms of medical care supply. So working with the local government authorities and with the local medical association test centers and with the regional outpatient test centers, we are working with all these, and we are delegating these tests to the local institutions we have traditionally encouraged, and that will continue to be promoted. Our position is for those who need the test must be available. That is important. So far, if if a cluster occurs undetected, yes, tests must be made available. About the PCR test, already Mr. Taguchi responded, the position of Japan is, if the medical doctor considers necessary, the test must be available. That has been the position so far, and that policy will continue going forward. The local medical associations organize test centers, or so-called drive-through test facilities, are expanded. The patient is increasing, the number of cases are rising, so under the situation where there are more patients, PCR test must be appropriately available. So in different local government authorities, they should do whatever is possible so that test capacity will be expanded and the central government will continue to support the local government authorities. About the flu-like symptom death, that there are more deaths than normal February, I think I have responded already. But as of February, in the latter part of February, in Tokyo alone, flu-like symptom death notifications is larger than expected or than average years. But the death notification, this is provided by the public health centers, but obviously they are very busy, and not all the public health centers provide the data. It is only a very provisional number, not a final number. Therefore, at this moment, just looking at that number of latter part of February, any evaluation is very difficult. Another point is the PCR testing criteria in Japan for severe unknown pneumonia. A PCR test is to be conducted. This has been the position from the very beginning, and therefore in the medical settings, this criteria has been implemented. So at this moment, amongst the death for unknown reasons, we do not expect that a large number have died because of COVID-19.
One more question coming from Simon Denier regarding PCR testing. And basically, I think what Mr. Taguchi and Mr. Kato has said is that the government of Japan has not restricted the testing at any point, and there is no strict criteria as such. But still, Simon wishes to ask whether the testing should be expanded to accommodate asymptomatic patients to identify these cases. And if you can tell us how asymptomatic patients are being treated in relation to PCR testing as well.
About those without symptoms, about to test or not test, about the asymptomatic cases, the PCR test, and not based on the patient's wish, but it's the decision by the medical doctor. If the doctor considers it necessary, then a PCR test should be conducted. Because the resources is limited, it is not unlimited, so those who should be given priority must be tested with priority. This is fundamental, and across the world, this is an established way of thinking. On top of that, for example, nosocomial infection, in-hospital infection, or if clusters already have been identified, in order to identify the scope of the cluster or to prevent in-hospital infection for those who have had close contact, even if they are not symptomatic, a PCR test should be implemented. MHLW has provided such guidance. So going forward, for those who do need a PCR test must be available.
Yeah, perhaps we should give Taguchi-san and Kato-san some breathing space. And I have some question coming from Francesca of Nikkei Asian Review. And this is about a different subject. And perhaps this should be addressed to Kojima-san of Cabinet Secretariat. The question is, how is the government preventing the spread of coronavirus inside prisons and immigration detention centers?
For prisons, countermeasures against infectious diseases in prison, I am not in the position to be knowledgeable, so correct response I think I cannot provide. I'm very sorry about.
Better information on this. So through some channels, we will try to get some answers for you on this matter. I have another a question from Rocky Swift of Thomson Reuters. The question is in regard to the Nagasaki cruiser ship. What lessons were learned from the Diamond Princess situation if such a similar situation, contagion situation happens within 2 months on this Nagasaki ship? Any comments on the situation in Nagasaki? Perhaps Taguchi-san, you should inform Mr. Swift as regards what steps are being taken and what steps will soon be taken from the quarantine point of view.
The cruise ship at Nagasaki, the Atlantica, the Diamond Princess, there are major differences between the two ships. From the end of February, this ship has been docked in Japan, and already quarantine procedures had been completed. Furthermore, on this ship, there is no passenger. There are only sailors and crews. About 600 or so workers, only laborers, sailors and crew only are on the ship. So that is very different from the Yokohama ship. There are many empty available cabins. At the moment, we are trying to find out the current situation of the ship in Nagasaki. About this case, the flag state is Italy, and the operating company of the ship is also an Italian commercial entity. By the request of Italy, for the prevention of infection, Japan is providing cooperation. That is the situation. On the 19th of April, from the 19th of April, the crew on the ship, they are staying in their own cabin, not to step out of their own cabin. That has been implemented from April 19. And we have also learned lessons from Diamond Princess. So using those lessons learned, appropriate countermeasures will be taken also for the ship in Nagasaki.
Thank you, Mr. Taguchi. This ship is the country of registry is Italy, and the location of the operating company, the headquarters, is also Italy. In that sense, the Italian government is involved, and as Mr. Taguchi mentioned, that there has been requests coming from the Italian government for us to cooperate on this matter as well. And we are using all the lessons and knowledge learned from the previous case in Yokohama recently as well. Now I would like to draw upon Simon Denier, Washington Post question. He's actually submitted 4 questions, and this would be his third. It goes, given that the 3-day spring equinox weekend seems to have caused the jump in infection, as you said, does the government regret not issuing much clearer instructions not to go out or declare an earlier state of emergency? Perhaps Mr. Kojima, you can take this question.
Indeed, the 3 consecutive holidays of the spring equinox, indeed, people sort of relaxed, were less alert, and infection expanded. That is observable according to the data as well. We assume that that has happened, and because of that lesson and experience at this time, before the Golden Week holidays of May, we are trying to continue the stringent behavior transformation, and we have extended the state of immersion declaration to the whole of the country so that the Japanese population will be encouraged. So that was as of April 16. So far, day after day, analysis is conducted, and on a daily basis, we are talking with the experts, and day after day, we have done maximum possible. And therefore, the 3-holiday situation of March, indeed, we have learned a lesson, and that is being reflected.
Thank you, Kojima-san. And the last question coming from Simon is perhaps for Taguchi-san. It goes, Professor Nishiura and Oshitani have produced 2 papers predicting the number of severe cases. The severe cases may top 200,000, and number of deaths may top 40,000. Why can't these forecasts be made public? And Oshitani, can they be made public?
So papers have been published? Yes, from an academic perspective. As a researcher, as an academic, papers have been made public, I understand. And of course, at our ministry, Professor Nishiura, Professor Oshitani, both of them are highly renowned experts of infectious diseases, and they are members of our expert advisory council. We will listen carefully to what they say, and their comments shall be reflected into our policy making.
So Simon, our understanding is that these papers are being made public. I noticed, Nishimura-san, you have some more questions as well?
再び西村ですけど。
Nishimura, once again, on PCR testing, once again. The capacity. What is the meaning of capacity? If you lack human resources, would that be considered part of capacity? That is 15,000 is the number. Per day, 15,000 is the number which has been given. The 15,000, can you actually do 15,000 tests in reality? That's the question.
In terms of testing capacity, yes, it is 15,000 per day. That is indeed the capacity, but in the actual medical institution, the public health centers, at the same time, there are patients who have tested positive, and there are other local medical challenges in parallel. And as a result, they are close to being overwhelmed, or they do not have human resources. We have heard such information, so we want to do whatever can be done.
That is, capacity can be the number of kits. Is that what you mean?
The kits and the capacity of the institutions. If there is not enough people, you cannot do it. You don't have the capacity if there's a lack of human resources. We want to avoid that situation where lack of human resources hinders the test. Please allow me to add the PCR testing capacity, the National Institute of Infectious Diseases, or the quarantine offices and stations, and at the local government authorities, there are the local health research institute. At respective institutions per day, the PCR testing capacity, the test numbers capacity have been added up. So for the whole of Japan, it is possible to conduct this capacity, but in order to conduct the PCR test, the sample has to be collected, has to be transported, and plus it has to be actually analyzed in the laboratories of the different prefectures. There are multiple steps in a particular locality. If there is a very large number of cases, then collecting the sample could not catch up, for example, or in a particular community. For example, in Hokkaido, the sample cannot be transported to Okinawa lab, for example. So on a temporary basis, in a particular community, there could be a lagging behind that test might not catch up. But as for the nation, 15,000 testing capacity for the country of Japan, that is what we mean by capacity, and we are trying to raise it to 20,000 capacity per day for the whole of Japan. I have another question.
Looking at the situation in France, 21,000 infected individuals died. 1/3 died in homes for the elderly. That is, they were not taken to the hospital. There were not many symptoms, but they passed away. In Japan, in nursing homes for the elderly, when people die, are they all subject to PCR tests? Or if that's not the situation now, are you thinking about doing PCRs in all cases?
As was mentioned before, for the people who are old or who have underlying diseases, we are trying to make it flexible so that the PCR testing will be available, also based on the judgment of medical doctors. And even with those without symptoms, they are being hospitalized if they test positive. So because the patient number is increasing, we are asking that they stay at homes or at accommodations if they do not have any symptoms or if it is mild enough, so that hospital capacity will be made available more for the severe cases. So it is quite different from the situation in France that you mentioned. But in the senior residence where people pass away, would they be counted as infected cases? If that was not the case, they just died for unknown causes, and after passing away by PCR, it was found out that they tested positive post-mortem only after the death. So it was not understood that they were infected before they passed away. So what about that risk or the possibility in Japan? Do you think there is also possibility like that in Japan? As Dr. Kato mentioned, if there is a suspicion of pneumonia amongst the residents, then if PCR test will be conducted for severe unexplained pneumonia cases, that has been conducted, and therefore, so for severe unexplained pneumonia, death cases, and if there is suspicion, a PCR test is conducted, and it will be verified whether it was COVID-19 or not. Please allow me to add. It's not for all, but the senior resident facilities across Japan, in majority, the head of the institution are medical doctors, or they have a contract with medical doctors. In most of such senior facilities, in some way or another, there is a strong engagement with professional medical doctors, according to our knowledge. And therefore, if anyone passes away, the medical doctors will provide a certain level of diagnosis, and if considered necessary, it would be subject to PCR testing. And actually, in multiple facilities, clusters have already been discovered in Japanese senior resident facilities, so those patients are counted. So all of a sudden, that in such a senior people's residential facilities, that sudden detection of a large number of deaths has not occurred.
Perhaps I should. These care facilities have been identified as identified as priority areas for protective and preventive measures. Since we knew from the very early stages that the elderly people would be facing a higher risk of fatality as well. As of this point, I do not have any more questions from the viewers, as well as those of you from the floor. So, Nishimura-san, if you have some questions.
すいません、何回も。
I'm sorry to ask so many questions. To prevent the elderly dying on their own, the COVID-19 do you think that will increase the risks of the elderly dying on their own? Are you taking special measures to deal with this?
Death in solitude, to die alone in their own room without being discovered by anybody. Die in solitude, to be found dead, living alone.
Are on their own. I see. Okay.
It could exacerbate all of a sudden while they are alone at home. Kato 室長か田口室長。
すみません、ちょっとその孤独死対策。
About the countermeasures about the death in solitude, we are not responsible, so full response cannot be provided. But for those who are staying at home, the public health centers and different institutions are trying to follow up, to follow the cases. And originally in Japan, there is a high level of access to medical services. So while feeling unwell and to stay at home doing nothing, we estimate that there will be very limited such cases. But what you have told us, indeed, we have to take care. And therefore, we will ask that question and check with the responsible division.
Let me let you know. And this question from Francesca of Nikkei Asian Review regarding the situation in prisons and immigration detention centers. We will get back to you as soon as we get some answers to your question as well. So we've done maybe 80 minutes or so. And if there are no more questions, perhaps we should draw to a close. Do any of the speakers have anything to add in view of the questions being asked today? If not, perhaps... okay, we have a last-minute question, and I guess this would be the final question. And it's from Simon Denier of Washington Post as well. I think this is for Taguchi-san. The line survey, the SNS line survey on the Ministry of Health and Labor Welfare website showed 27,000 people out of 23 million reported fever for 4 or more consecutive days. Given that the flu season appears to be over, does this worry you or suggest there may be a large number of undiagnosed COVID cases?
At this moment, we do not have the person responsible for that survey, so detailed response cannot be provided. But by collaborating with private companies like Line and others, we want to know better about the health status or about the changes in the behavior. Surveys, questionnaires will be conducted in order to encourage people to change their behaviors. There could be undiagnosed patients. If there are undetected patients, for those who the medical doctors consider tests are necessary, a test will be provided. At the same time, the testing capacity and the medical services need to be expanded, and efforts will be made.
Taguchi-san. Simon, thank you for asking this question. The line survey is indeed something that the Ministry of Health, Welfare and Labor has embarked upon, which no other country perhaps has done on this scale. But I think perhaps if we have more on the analysis side of the results of the survey, we will certainly let you know as well. Perhaps that would be the final question. And if there are no more questions, we should complete this conference. Thank you for listening, and thank you all. And thank you, speakers. Thank you.